Today we're going to be talking about non-specific lower back pain. It's a topic that I've covered before, but there have been a couple of comments and questions about it. So what we're going to try and do is talk about those or answer those questions and comments, but I'm going to use this video to do it. If you are struggling with lower back pain and you want some help, you need some clarity, you need some ideas about what you can start to do with regards to rehabilitation, click the link below and go through to my How to Overcome Lower Back Pain online consultation and coaching, and we will get you on the road to rehabilitation. First of all, we've got to understand what non-specific lower back pain is. And we're going to do that by using this little diagram on the screen here that you can see. So as it says here, non-specific lower back pain, which is a no clear patho-anatomical diagnosis, absence of red flags. And that makes up for about 80% of lower back pain. Now, to put that into some context, 60 to 80% of the Western population, these are the sort of the range of stats that we tend to read. So 60 to 80% of the Western population will experience lower back pain at some point in their life. So 90% of that 80% will be diagnosed with something called non-specific lower back pain, which is basically the practitioner saying that we don't know what's causing it. Now, if they don't know what's causing it, there is really no way of rehabilitating it. So on that level, they're basically saying, I don't know what your lower back pain is, and I don't know what you need to do. But here's some exercises and here's some stretches anyway. Go and do them and hope for the best. That's essentially what's being said. Now, what I'm going to say, and it's been said before, that there isn't really anything called non-specific lower back pain. That doesn't really exist. All that exists is someone saying effectively what I've just said, is we don't know what's causing it and I don't know how to rehabilitate it. Then it just gets lumped in a category called non-specific lower back pain. But because it's in journals, it's like, okay, well, yeah, it's that. I don't know what to do about it, so just go over there. Now, in my eyes, that's not necessarily the most effective way of doing it. Now, what we're going to talk about now is how can we take someone who's been told they have non-specific lower back pain and call it specific lower back pain. That's what we're going to dig into now. Now, what we then get is 5 to 10% of them lower back pain with significant neurological deficits. So that's cordia equina syndrome, sciatica due to symptomatic disc, so the disc is touching the nerve, prolapse or lateral canal stenosis. Then we've got central stenosis, and then symptomatic spondylolisthesis. So we can find out on an MRI scan, we can also do it through testing, but we find out essentially that there's something like that happening. Then we can start to call it what would be described as a specific lower back pain. We know what's causing it, and then we can start to put together something sensible with regards to rehabilitation. Then we have something more serious, malignancy, systemic inflammatory disorders, infections, fractures, diagnosis based on clinical examination and investigation. So these two would be described as specific lower back pain, which make up, let's just say, 10% of lower back pain. And then we have this one, which is 90%, which is where we don't know what's going on, so we don't know how to deal with it, but here's some stretches and exercises anyway. Now, why might someone come to the conclusion that they have non-specific lower back pain? Well, if we look at the traditional patho-anatomical diagnosis model, the most common diagnostic model for musculoskeletal conditions attempts to identify a specific tissue pathology that is presumed to be the source or cause of the client's pain or dysfunction. Now, many of these patho-anatomical findings can coexist. So there could be multiple tissues. Movement impairment could be different. So we could start to get inconsistent results. We could start to get results that don't really make a great deal of sense. So what we have to do is we have to add something new into the model, which isn't really being put together. And again, through my online assessment that I've got and through my face-to-face assessment that I use, we'll start to talk about what all that looks like, and what we're going to talk about next is what that's based on. And it's a Kineso pathologic model, which is essentially a movement system. So what we're now starting to use is not only a specific tissue, but a specific movement that's causing pain. So this model creates diagnostic classification related to the characteristic movement impairments that are the cause or consequence of the client's pain or dysfunction. Now, one of those movements could be spine flexion. As you can see here, spine flexion from lifting or spine flexion from sitting. Now, another one could be spinal extension. It could be spinal rotation. That's meant to be rotation or twisting of the spine. So we've got these different characteristics. Now, again, this can all be done through testing. So we can start to find movement characteristics that are creating the pain. What we can also do, again, this isn't necessarily a part of the of this movement system, but again, it's another part of what I use. But we've also got trigger points. So we've got a trigger point in glute medius, which creates pain at the base of the spine. You've got another trigger point in glute medius, where it's in the buttock and sort of the top of the hamstring. So you can start to see that we've got all these different potential triggers for lower back pain. You've got movement. You've got the biomechanical or biomechanics of the spine, which is this spine flexion. You've got trigger points. You've got hip range of movement. You've got core strength, core stability that are all part of assessing the area to find out where the weak links are that you can start building up. So what we've got to come to some sort of understanding is, where is the impairment coming from? Are we just categorizing it as lower back pain, which is just a pain that comes from the lower back? But what about all the different tissues that are involved? What about all the different movements that are involved? That's somewhere where we've got to start going to be able to understand the specific nature to each person's lower back pain and not just lumping it into non-specific lower back pain. So when it comes to what I do with regards to the online assessment and the face-to-face assessment, these are the tests that I use. So I use spine biomechanics tests. Now that comes from Dr. McGill's book, Low Back Disorder. I've essentially taken the tests out of there and I take people through it. You've then got hip range of movement tests. Is that having an influence? Because they can have a spine trigger, but they can have perfectly working hips. Or they can have a spine trigger, but they've got really tight hips. Or they don't have any spine triggers, but they've got really tight hips. So the hips could be a driving force in that, if the spine's not a driving force in that. There are also trigger point tests. So looking at specific muscles, I basically take 7 muscles of the lower back and hips and assess those. And I'd look for, are the trigger points creating pain within the lower back? Or is it the core strength / endurance and stability of the core and the hips? So again, we test that. And what we're looking for, because again, this might be clear. The spine might be clear. If the spine's clear and there's no triggers when they go into flexion, extension, when it's loaded, when there's compression on it, and all these different things, if there's none of that, then again, the spine's not triggering it. So it must be the hips, it could be the muscles, it could be the core and the instability through there that's causing it, or creating it, or influencing it. So we have to look at all of these. But again, the hips could be clear, they've got really good functioning hips, but there's lots of triggers in the spine. Or they've got muscle trigger points and everything else is clear. So we have to come to some sort of understanding about where it's coming from. So what we can then do is say, okay, you've been told you've got non-specific lower back pain. We don't know what the problem is, or that's what we're saying anyway. Well, have they tested the spine? Have they tested the hips? Have they tested the trigger points? Have they tested the core with regards to the stability of it or the endurance of it? So we need to be able to come to that understanding to find out where the holes are within the person's lower back pain, so we can start investigating a little bit further. Because if everything's clear, if the spine's clear, the hips are clear, and the core's clear, but they've got really sensitive muscles and trigger points, then again, we need to investigate, okay, well, what muscles are doing it? Where are you experiencing the pain? Which will start to tell us what muscles experiencing it. Then we can go through a palpation to see if those muscles are sensitive and there are trigger points within them. So you can start to see it's not just a case of, I'm qualified in this test or this method of training. What I'm trying to do is bring a broad approach to it, so I can then look at that broad approach and then investigate further in as that broad approach starts to tell me, go and investigate the muscles, go and investigate the spine, go and investigate the core, so on and so forth. So it's about building that and building that out in that assessment process. So when the rehabilitation part comes, it's much easier because essentially your body will tell me what it needs through this testing process. If you found this information useful, you think other people will find it useful as well, click the like button below, subscribe to the channel, click the bell icon, because it helps me promote these muscles within YouTube and bring it to a greater audience. So again, if you think this has been helpful, please do click everything below, and many thanks, and I'll speak to you in the next tutorial.